Ladies and gentlemen, dear colleagues and friends, it's my great pleasure to be here today to open the second day of this conference, and I thank you for your kind invitation. Let me start with a few words about what health is and why it is so important to us. Health, as defined by the World Health Organization, is not merely the absence of disease or infirmity, but a state of complete physical, mental, and social well-being. Good health is an integral part of human happiness and well-being and is one of the founding aims of the European Union. Good health not only allows citizens to be more innovative and productive, but it also contributes to economic progress and social and economic stability of the member states, and as such should be protected. Lifestyle-related risk factors, such as poor diet, physical inactivity, alcohol consumption, and smoking, contribute to the rising burden of obesity and non-communicable diseases, including cancer. They directly affect the quality of life and life expectancy of citizens and have a negative impact on national health and social systems, government budgets, and the productivity and growth of our economy, including the future workforce. The COVID-19 pandemic has triggered an unprecedented global health crisis. The fact that too many of us suffer from non-communicable disease has rendered our societies even more vulnerable to the sudden appearance of health threats. The impact of COVID on people with obesity or diabetes, for instance, showed that often overlooked side of the need for societal resilience. We already knew that a healthier society is one with more wealth and capable of generating more health. It is now also abundantly clear that a healthier society can resist better to health threats. In addition, as a result of the pandemic, many EU countries face an increase in already high rates of overweight and obesity among adults and children. Let me remind you that even before this crisis, up to 70% of national health budgets were spent on treatment of diseases linked to obesity, while only 2.8% in health promotion and disease prevention. Obesity alone was responsible for reducing life expectancy by up to 4 years, removing up to 4.5 percentage points of GDP growth and consuming up to 7% of health budgets. We know that the almost exclusive focus of our health systems on COVID-19 since 2020 had relevant consequences outside the remit of infectious diseases. Diagnosis and treatment of non-communicable diseases was forcibly postponed. Health promotion and prevention activities have been put on hold. If you will allow me to use a cliché, one that happens to be true, we have a time bomb on our hands here. A situation that was already serious has become more challenging and has all the conditions to become worse still. We have an obligation towards the future, and we must build back better. And this has to be done across the board, with all stakeholders chipping in. We do not mean to tell people how to live. By and large, they know what a healthy lifestyle is. But we must recognize that there is much working against it. Food marketing on social media, the way products are placed on supermarket shelves, the poor nutritional quality of canteen meals, sweetened school milk, or the lack of cycling lanes. In other words, the odds are often stacked against citizens, especially children and the most vulnerable. And it is much harder to make good choices under these circumstances. The choice environment strongly influences personal choice, and this includes commercial determinants of health. Inaction of other sectors will result in costs that will ultimately be borne by the budget of our health systems and by our health. The lessons learned from the COVID-19 pandemic force us to re-evaluate our existing framework of action at EU level. We need to take this opportunity to put long-term solutions in place. This is why, in her 2020 State of the Union address, President von der Leyen called on Europe to build a robust European health union. The Health Union package gives the EU a more comprehensive toolbox for preparedness, surveillance, early warning, and response. In addition, the new EU for Health program is the key financial tool to protecting our citizens' health, fight major public threats like COVID-19, and to reinforce Europe's health systems. Under this program, the EU will invest 5.3 billion euro in actions with a view to complementing EU countries' policies and achieving 10 specific objectives, including health promotion and disease prevention, for which a minimum of 20% must be reserved. It is also relevant to mention that a major opportunity for countries and stakeholders lies in the context of the Horizon Europe program. This is a key EU tool to improve our knowledge and evidence base on NCDs in areas where we have gaps. We have been working hard in hand with our colleagues in DG RTD and invite member states to support this approach and also to do the same at national level. To prevent the onset of chronic diseases, reduce the incidence of obesity, and support national efforts to reach the objectives of the United Nations Sustainable Development Goals and the WHO targets on non-communicable diseases, the Commission developed two strategic documents: the Farm to Fork Strategy and the Europe's Beating Cancer Plan. Allow me to explain both of these strategic initiatives a bit more in depth. The Farm to Fork Strategy, adopted in May 2020 as part of the European Green Deal, aims to accelerate the transition to a sustainable food system that should have a neutral or positive environmental impact, reverse the loss of biodiversity, and ensures that everyone has access to safe, nutritious, and sustainable food. This strategy sets out a roadmap towards sustainable food systems, which recognizes the inseparable links between healthy people, healthy societies, and a healthy planet. In this respect, the Commission prepares a number of initiatives to promote healthy diets, reduce aggressive marketing, stimulate reformulation of processed food, and improve information to consumers. Altogether, these will help facilitate a shift towards healthier and more sustainable diets across all generations, reduce obesity rates and related non-communicable diseases, and create a fair, healthy, and environmentally friendly food system where the healthy choice is the easy one. The other flagship initiative I mentioned, Europe's Beating Cancer Plan, adopted on the 3rd of February 2021, is a top priority for the Commission in the area of health. The plan is a real game changer, as 4 billion euros will be available for cancer prevention and care. Europe's Beating Cancer Plan addresses cancer in a holistic way through 4 pillars. 1, prevention, 2, early detection, 3, diagnosis and treatment, and number 4 is quality of life of cancer patients and survivors. The first pillar aims to prevent the preventable and address key risk factors like smoking, alcohol consumption, unhealthy diets, and lack of physical activity. To complement these efforts, the Commission launched in 2021 the Healthy Lifestyle for All initiative. The campaign is based on 3 pillars: increased awareness of a healthy lifestyle across all generations, easier access to sport, physical activity, and healthy diets, with special focus on inclusion and non-discrimination to reach disadvantaged groups. And finally, teaming up for a holistic approach to food, health, well-being, and sport. At the occasion of the ceremonial launch, which took place on the 23rd of September 2021 in Bled, Slovenia, the Commission signed 9 pledges, including the commitment to support EU citizens to make a shift towards healthier and more sustainable diets. It is in this context that we should discuss the topics of today and, most particularly, the ReMaP joint action. It is important to stress that food reformulation, reducing the aggressive marketing of products high in fat, salt, and sugar, and public procurement are actions with the highest potential to improve the health of our citizens and bring their diets closer to national dietary recommendations. Reformulation removes excess sugars, salt, and fat from products that are bought every day in EU supermarkets. It helps citizens of all social backgrounds to have healthier diets and supports innovative companies. Better monitoring systems for reformulation will inform authorities, consumers, and industry about the scope for improvement in food products. Since what gets measured gets done, this can strengthen national reformulation initiatives and support consumer choice, innovation, and a level playing field for industry. Public procurement of food, that is, food bought by public authorities, represents an opportunity worth 80 billion euros per year. It should act both as a stick and a carrot to help steer demand and supply of healthier food options, first of all in schools. As for marketing, any parent can immediately relate to the challenge of protecting children from inappropriate ads, and existing evidence on children's exposure to food marketing, especially online, is alarming. For these reasons, the ReMaP joint action is a most necessary and most welcomed initiative. We all need to hear member states deciding to do more on reformulation, on public procurement of food, and on marketing of food. And in all these areas, we have a winning team. Almost all EU member states are participating in this initiative. You have the evidence base. You can ask for guidance to those of peers that have already successfully introduced ambitious policies. You have EU support in the form of the joint action. With these conditions in place, we have an excellent basis to move decisively forward, and I trust that at the end we will have many more additional examples replicating the already successful ones. We need these efforts to reduce the burden of non-communicable diseases. Let's do it. And let's take this news also outside the circle of those that are already familiar with this positive, progressive message. Ladies and gentlemen, Europe is now in a transition period, and many challenges such as prevention of non-communicable diseases remain to be addressed in the near future. The Commission puts high importance on fighting overweight and obesity and improving nutrition, since they remain some of the major health determinants and of non-communicable diseases, including cancer. In concluding my speech, let me reassure you that we will remain fully committed to supporting the Member States in achieving the UN Sustainable Development Goals and the WHO targets on non-communicable diseases. And I look forward to hearing and discussing the views of the participants of this conference in the upcoming sessions. Thank you very much.
Thank you very much. Your talk has been incredibly clear and effective, as we were expecting from you, knowing your experience and your track record in this field. I'm glad that we have about 10 minutes for a Q&A session, and I hope you're willing to stay on for the rest of this session to answer participants' questions. We have over 130 participants connected at the moment, so I'm sure there will be lots of questions. As usual, I would encourage everyone to put their questions in the chat or raise their hand if they wish to ask their question in person. So maybe while we wait for people to gather their thoughts, Stefan, I could start by asking you a question about one of the documents that you highlighted in your talk, the farm to fork strategy. That is clearly a reference point, a major reference point for DG Santé in the area of addressing obesity. Really gives us an opportunity, to strengthen the case for improving the food system in the direction of improved health outcomes, because in many ways, health outcomes really go hand in hand with environmental sustainability outcomes. So the environment is really a strong ally for health in improving the food environment. But what actions are you concretely doing at the European Commission level to join forces with your environment colleagues to really create synergies between health and environment in the action of the European Commission on the food system?
Yes, Father. There are many actions ongoing, and what I would say, in principle, it's very simple. I mean, the food that is produced should be healthy both for the environment and for those who eat the food in the end. And that is, in a way, a natural synergy, which is already there from the start. And then it's, of course, clear that many of the elements which can pose risks for people in the food they eat are also at the same time a risk for the environment. And so that's the starting point of everything. And the colleagues are in permanent close contact with the colleagues in DG Environment to ensure that basically this synergy idea is maintained in all the individual actions that are planned.
Thank you, Stefan. We have a follow-up question on this from Karen Schindler from Austria. She's asking how health experts and health issues are included in farm to fork discussions. Do you feel that there is a full inclusion of a health perspective in these farm to fork discussions from your perspective?
Yeah, essentially, we have these discussions every day. You know that obviously inside DG Santé, there's a lot of the expertise which is necessary and leading in the Commission on both aspects, the environmental aspects, the food safety aspects, but also the health aspects. And I know that the colleagues here in the health part of DG Santé are actually in almost daily contact with the colleagues who are in charge of the food aspects. So I think this is really made easier by the fact that they are both in one DG.
Thank you. So we have a question from Moitza in the chat. Would upgrade with the DG Grow in the scope of sorry, Moitz, I can't fully understand. Maybe it's easier if you ask the question directly.
Yeah. Thank you so much. And thanks to Stefan for really a great speech and introduction and giving us such a strategic overview. I'm just wondering, because we have the policy decision-making forum in Best-ReMaP, where we would like to get the political guidance. So what we are doing and how that goes in line with the plans of the Commission and the high-level member states. And we are trying to invite also DG GROW to join, because there is the directive on public procurements. So how could Commission here help us? If you have any comment, we would really like to have them at the table to understand how can we best prepare the possible actions in the area of public procurements. Thanks.
Yeah, we can certainly try to intervene here. I mean, DG Growth is also a part of the Commission, and we will see whether we can help.
Mm-hmm.
Yes.
Mm-hmm. Okay, thank you so much. That would be really very valuable. And back to Franco, I doubt, because sure. Yesterday we were 206 and today we are already more than 130 interested people. I doubt we do not have questions, specifically in the line of the yesterday's presentation of Diana. So back to you, Franco.
But I'll take advantage of our participants being shy or quiet at the moment to ask another question to Stefan, which I'm really keen to hear the views of the Commission on. So that's about food labeling, nutrition labeling, which is a very hot topic at the moment. Of course, I completely understand that the European Commission has has to be neutral, relative to this debate, and this is very politically charged at the moment. However, I wonder, what DG Santé can do, to ensure that the, political clash that is going on at the moment is not going to dilute, the policy when it's finally implemented. I mean, we're all very keen to see, mandatory labeling implemented in Europe in the near future. So, can you give us some reassurance that this is going to happen and the DG Santé is going to, fight for this?
Well, you can be sure that we are doing our best to ensure that the health aspects are appropriately visible and heard in the process. Yes, what I wanted to say is that, of course, we are making sure that as part of the process, the voice of health is appropriately presented and heard. But we know this is a politically complicated process. And we also know from experience and history that we don't know exactly what the outcome will be. But we hope for a good result, because as I said already, the COVID-19 pandemic has demonstrated that actually prevention of non-communicable diseases is not just important because they are a burden on the health systems in normal times and a problem for health in general. But during a pandemic, those suffering from non-communicable diseases are particularly vulnerable. So it's also a question of better resilience in pandemic times. So if you so wish, the pandemic has given us an additional argument why it is important for the society as a whole. And so we hope for the best in that respect.
Thank you, Stefan. I see Igor as his hand up. Igor, would you like to take the floor?
Yeah, thank you. I would just like to continue the question that you asked on this approach of labeling of nutrition declaration in shorter form of lot of packages. We saw a few days ago that EFSA published a very interesting draft document on this topic. And I wonder, can you just maybe, Stefan, can you explain what are the next steps? We saw that the plan is to have something available by end of next year. Now, first we saw a review of available schemes on the market. Then we saw this EFSA document, which will be finalized, I think, in beginning of 2022. So what are next steps for the Commission for harmonizing all those issues with the member states? I think there is a lot of different opinions, and we are all, really, we would all really like that something would happen, that we would really finish with a mandatory labeling which would support healthy choices in consumers.
Sorry, I don't know the details about the timelines which is planned by the colleagues. And I don't know in how far that is influenced by new evidence and the EFSA report that is available. Sorry that I can't answer this question to you now. I'm
sure maybe there is a comment from Arthur, your colleague in DG Santé, Stefan. The role of the Commission is relevant, but that of the countries is essential. We all wish and wait for the full commitment. Perhaps this forum will include that already. We're really looking forward to hearing more about this in the near future, because as Igor also mentioned, this is something that the entire public health community really cares a lot about, and we're hoping to be able to see a strong policy implemented in the near future, at least as strong as the farm to fork strategy implies, which I think would really be a major step forward in addressing obesity in Europe. Okay, I think we have probably reached the end of the session. I would really like to thank Stefan for his very clear and very exhaustive presentation. I think
Hi, Franco. Hi, Franco, but we have got a very interesting question in the chat, if we can respond to that, because I think physical activity is always a bit behind the nutrition. If we take a short minute here, I think we will catch up. I think it's a pity to lose such a question and respond from Stefan.
I wonder if Randy can perhaps ask the question directly.
Yeah, because mentioned the bicycle paths in Stefan's speech, and because everyday physical activity is the most efficient and effective way to have people reach minimum recommendations for physical activity. However, most of the other comments and references to policy documents refer to sport. So that's really the question. We are speaking about sport, which is something most people don't consider to be same thing as walking and cycling for transport. Can you reassure us that active transport is receiving the attention needed and not the poor cuisine of sport with the low funding levels with the Commission increased funding for active sport? But I think that's something, Stefan, we are discussing, or we have been discussing at the high-level group meetings at least once annually. How is that going on now?
Yes, of course. I mean, indeed, there might be sometimes a terminology problem, and indeed, the term sport might not actually, in the minds of people, cover everything that is relevant to avoid physical inactivity. Yes, and we are, of course, aware of that. Now, when it comes to the funding levels, will the Commission increase funding for active transport? That's not something I could comment on. All I can say on that is that there might be several relevant programs, and but how the funding will develop there will be discussed in the fora, which are the governance fora for those programs. And you have usually program committees, and it will be discussed with member states. And that brings me back to Arthur's comment earlier. Ultimately, it is clear that we can't impose anything on member states. Either we are in the area of legislation, then we have the co-decision procedure, and member states have to agree in the council with a majority, or we are in the sphere of health, where we have basically voluntary cooperation of member states and no possibility anyway for the Commission to impose something. So also here, I think it is really key what member states want and what the national policies are. And if a majority of member states supports, then we can do a lot. And if that's not the case, then it will be problematic.
Thank you, Stefan. Thank you so much. Moitze, if there is no other question, I think we should move to the next session. And thank you again, Stefan. I think we're going to see you again in the afternoon in the policy roundtable.
Yes.
So it's not a goodbye, it's a see you later.
See you later.